Hello, everyone. Good morning, good afternoon, or good evening, wherever you are. I'm very pleased to start this webinar. I'm João Bosco Monte, the president of the Brazil Africa Institute. I have the honor and the privilege to have with me important personalities from many parts of the world. I have here José Ramos-Horta, the former president of the Democratic Republic of Timor-Leste and Nobel Prize Laureate. I have Gilbert Houngbo, president of the International Fund for Agricultural Development. And I have also Ambassador Celso Amorim, former Minister of Foreign Affairs of Brazil. So thank you very much for your kindness, your participation. And also, I would like to thank the participation that we have from people from many parts of the world as well. How this moment is affecting people everywhere. We are facing a very important moment in the history of the world. The pandemic is affecting people in many places, and I have here the opportunity to hear your voice, to understand your ideas about the perspective and the trends that we have in front of us. To start this webinar, this is a dialogue. So I have the conversation now with some friends. So this is not a lecture. We're going to give to our audience some perspective about what we think about this situation. And I would like to start with one question for everybody, from Mr. Gilbert, from Mr. Celso Amorim, and Mr. José Ramos-Horta. I will start with you, Dr. José Ramos-Horta. Look into the region where you are located. How is the situation now in Timor-Leste? And also, how the situation in your place, in your country, in the region where you are located, can affect people in other parts of the world?
Well, here in Timor-Leste, I can say that as of a few days ago, we no longer have a single case. For over a month, we had 24 cases, 22 Timorese and 3 foreigners, all imported. The Timorese who got it, they got it in Indonesia. They were living there, they were studying, they came back, they were detected positive. They were hospitalized, and we have been helping. We have had technical assistance from Australia to set up our lab, training our personnel in a speedy way, also working with WHO, UNICEF, the whole UN system. And I have to say, all 24 have been cleared. They left hospital. We don't have a single community transmission. We don't have a single death. So Timor-Leste right now is free of COVID-19. But we are continuing prevention. We are continuing tests in areas that we know may be sensitive. But so far, in all the areas we have done tests, and these tests are credible, we have a 0. But we have a physical land border with Indonesia. And Indonesia right now is one of the most impacted countries in Asia. Singapore, after a period of enormous success, now has serious number of cases. South Korea, they are worried that it's coming back, even in China. But I have to say, we have not seen yet the worst in Asia. India, gigantic country, 1.2 billion, 1.3 billion. Pakistan, Bangladesh, and all the countries in Central Asia. Are we going to be able to prevent a catastrophe in India and so on? But nevertheless, what is happening is already impacted the lives of hundreds of millions of people around the world. It shows the weakness of the international system. The United Nations itself, already a year ago, Secretary General Antonio Guterres himself was complaining, was talking about difficulties of finding finance for the core budget of the UN and for UN agencies. So the UN was already undermined by the major powers, particularly United States, but undermined also by many member states who are not paying their assessed contribution to the United Nations system. So before coronavirus, before the global recession, the UN system itself was already undermined by the lack of will on the part of member states to strengthen the international system. The coronavirus, even impacting more, remind me a bit like the League of Nations. We can see the collapse of the whole system. We will see how long this is going to go.
All right. Thank you very much, Dr. José Ramos-Horta, for your contribution. We have an idea in what is happening now in Asia, but we'll come back for the global system soon. Now, you are now in Dili, in Timor Leste. Let's go to Europe. Let's speak now with Dr. Gilbert Houngbo, who is the president of IFAD. Look into this perspective. What is impacting now Europe, but also I know that you have a very important idea about Africa because you've been Prime Minister of Togo. So what is impacting now in Africa, in Europe, can be affected now in other parts of the world?
Thank you so much, and I'm very pleased to join this webinar. Obviously, we know that in Europe, in most of the countries, the situation is now getting progressively back to normal, or back to a new normal, shall we say? And we do hope that it will continue like this. Obviously, one of the challenge that Europe is facing is managing the coming back, the return to a new normal seem to be as complicated, if not more complicated, than the lockdown itself. And the balancing act between the priority to health and ensuring that you keep also a minimum on the economic level, that balancing act remains quite very challenging to every country. So next door in Africa, globally, the Africa continent has been relatively with not excessive number of cases. South Africa and Cameroon are the two most affected countries in Africa. Otherwise, most of the other countries, the numbers are quite much more reasonable. However, and maybe because it's reasonable, is up to yesterday, I was again in a conference called 2 days ago with colleagues with WHO Africa. It's still difficult to predict when the peak. When are we going to get the peak in Africa? We just certainly cannot say as of today that the peak has been reached. So you still have that uncertainty there. On the flip side, given the fact that it has been extremely difficult to expect the population in Africa to observe the social distancing, given the nature of the daily activity, particularly from the informal sector, it has been quite very challenging in to what extent the economy can be kept locked down for a while. So in many countries, the economic activity has to resume, despite the fact that they don't know yet if they have reached the peak. What is also we observe is that the socio-economic impact, and I'm talking about Secretary General Gutierrez has been very forthcoming in making appeals on that. When you look at the socio-economic impact in Africa, already 2/3 of the population in many countries were already below the poverty line. And therefore, given the current challenge, the risk of having food insecurity or an increased food security is quite very, very worrisome. And also, it's amazing to see how the whole world is interlinked. Because of the lockdown, countries that are ready or are preparing for the planting season cannot have access to the inputs, to the fertilizers. And therefore, there's a risk that the next season production may be severely affected. On the other side, countries that are just being reaping, you don't have the market are locked down, the hotels in the cities are locked down, and the local market are not there. So the production now is being wasted because of lack of storage facility or basic transformation. So the international market also with some of individual border closing is having on the trade dimension a severe impact also on the Africa continent, given that Africa on annual basis imports as a minimum around 35 billion sub-Saharan Africa, 35 billion US dollar of food imports a year. So you can imagine that with the international lockdown, the risk on food challenges is also very high. I must say though that despite all of that, the momentum or the hope from the population remain quite very high, which is not a bad idea. Over.
All right. Thank you very much, Dr. Gilbert Houngbo, for your contribution. We had the opportunity to hear from Dili, from Europe, Togo, Africa, and now we are coming to South America, to Brazil, to hear the voice of Dr. Celso Amorim. We are here in Brazil. We face a very important situation, dramatic situation, I could say, in Brazil. What's your perspective? What is happening now in Brazil, Ambassador Amorim, that could affect other parts of the world as well?
Well, I think, first of all, let me describe a little bit the situation in Brazil. I'm sure that you have been following, but anyway, because it's part of the headlines. Brazil has
Looks like we are having problem with the microphone of Ambassador Amorim. Let's just try to refresh his mic. Let's come back to you, Dr. Ramos-Horta. I think Celso is coming back now. I'm sorry, sometimes the connection is a tricky. We have no control. We are in very different places in the world, but I'm sure that with some patience we can bring some answers. Right now,
I'm sorry. I'm sorry.
Celso, you're back now. I can hear you very well.
I'm sorry. I understand. Are you? Yes, but I can't hear you well. So I think I'll have to change my place here in the house. I'm sorry. For a moment, please.
All right. Okay. So it's I don't know how easy it's for you to adjust with this technical situation, but sometimes it's a tricky. It happens. Yes. Celso, we can hear you very well.
Well, okay. Let me try again. I can't hear you very well, but anyway, I can say some words. As I was saying, Brazil is on the top of these countries with most cases and also the biggest number of deaths. So we are certainly an example not to be followed, contrary to what happened in the past, in which we were very proud of our technical assistance to Africa, especially to other countries. Of course, East Timor. I remember having been in Timor Leste to discuss questions related to training for people in industry and also in Africa for agricultural and health matters. Now I think Brazil is an example not to be followed, because I think for a long time the example of President Trump, who denied the importance of the pandemic, was followed here. And even after Donald Trump somehow changing his behavior, we insisted, more or less. When I say we, it's basically the federal government. Brazil is a federal system, federative system. So the attitude of the governors is not exactly the same of that as that of the federal government. But we are doing very poorly, I must say. We had time to prepare ourselves. Maybe to some extent it would be inevitable, but if you compare, for instance, our performance to that with Argentina, which started having the cases more or less at the same time as Brazil, and there, I mean, the last figure was less than 400 deaths, and in Brazil we are on the 20,000. So even if you take into account the proportion of the population, we are still having many more deaths and many more casualties. So all this is very worrying, and we have also, it must be said that on top of the health crisis, we have had a political crisis. Only to mention that the minister we are already with the third minister of health in less than 40 days. So I think this in itself shows how much we are in disarray, without going into the merits and the ideologies. But in any case, this is really what's happening. So I'm very listening from both of you, but especially from Ramos-Horta. I feel a little bit envious. I remember a former late scholar from Kenya who used to say Kalestos Juma. Probably Gilbert Houngbo has heard about him. He always said that for each African problem there is a Brazilian solution. I think now it's the other way around, maybe, or we have to find a solution from Timor Leste, because here it's really very bad. And I say it's not a general situation, because in Argentina it has been different. Okay.
All right, Celso. I think we have to learn from Timor Leste as well. I think we have to see how they do their homework, and then we can apply in our situation. We had a very good conversation 2 weeks ago here in this webinar, in this room, and I had the privilege to receive the Director General of the World Health Organization, Dr. Tedros Adhanom, and he said that we need to prevent, and he emphasized the word prevention. How can we prevent the world for a second phase or a second cycle of this pandemic? Dr. José Ramos-Horta, you're saying that in Asia, in your country, there is not too many problems, but how possible it will be for us to avoid another apocalyptic moment after this pandemic?
Well, I can speak only for Timor Leste. No? We are fortunate geographically that we did not have tens of thousands of tourists coming from all over Asia, Europe to Timor Leste. So we have very little movement of people, particularly during that period, November, December, January. The moment we decided to take action, we took quick action, closing the land border, maritime border, the airports. We immediately, we were not prepared because it's a poor country, but we immediately got the WHO, the UN system, our Australian friends, to help training our people. We set up our lab. We have plenty of Cuban doctors here. We have Timorese doctors with more than 1,000 doctors for a population of a bit over 1 million people. And so the secret, I think, to any success in dealing with this is you intervene very early on. I was chatting with our Prime Minister way back in February. I told him, Prime Minister, better that you are accused of exaggerating, overreacting, than later you are accused of not taking action. So move to close the universities, schools, etc., etc. That's what we did. We continue to survey, we continue to prevent a lot of publicity, a lot of information. People are very civic. Our people, they follow the instructions from the government, from the health authority, meaning hand washing, every place, public place, supermarket, they're closed, shops are closed, the popular market in the neighborhood, they're open, they are not closed, but everywhere, even in the humblest little shop, there is water and soap. You go and try to buy some whatever you need to buy from a little shop in a poor neighborhood, they have water and soap there. So, and we distribute as much as possible masks, and people making local masks, they improvise. So that's the best to prevention in involving everyone. The rest of the region, of course, we have different levels, very sophisticated Singapore, South Korea, Japan, Taiwan, etc., very sophisticated China. And then you have crowded countries like Bangladesh, we have India, Pakistan, much more difficult for them to manage. One dangerous epicenter is Indonesia, but I have the greatest faith in the way the Indonesians handling. Difficult because it's a huge country, 275 million people, spread over thousands of islands, difficult to control their borders, maritime borders. But even so, in spite of a spike in the case in Indonesia, in proportion to the population, the infected people, the positive people, and death is still manageable. And I believe they will be able to contain. The problem is the economies have stopped. We are dealing with coronavirus, but then there are hundreds of millions of people who are losing their jobs. And that is the biggest challenge to each of us, the government's biggest challenge to the international community. What I want to say is this. Hundreds of millions of people overnight literally lose their livelihood. Who is responsible for that? How can we mobilize the international community, the reach of Europe, but also the reach of Asia? And not only governments, but banks, foundations, billionaires, the scandalously rich billionaires in Asia, the scandalously rich billionaires in America.
Dr. Ramos-Horta, I know we're going to come back to this issue about this cooperation. Please don't give all the recipe now. Let's just wait. I'll come back to you very soon to ask about this as well. I know that we have to talk about this situation. But let me come to both of you, Ambassador Amorim and Dr. Gilbert. There is a combination of efforts that we need to do. We are now having a lockdown in Brazil. In some parts of Brazil have lockdown, and lockdown is being in many other places. But what is the effect of the economy? Dr. Gilbert, you mentioned about trade. If I take an example, Ghana imports 1.2 billion tons of rice every year, which represents around 70% of the consumption. If the borders are closed, how possible it will be for the trade industry, and also the economy? I would like to address the same question for both of you. Ambassador Amorim, you can start looking to the Brazilian perspective. I think Ambassador Amorim, he's is not with us. Let's come to you, Dr. Gilbert, please.
Thank you so much. No, you gave a very good example, the case of Ghana, which you can multiply by so many countries. That's why what I was saying is that if you take the globe or sub-Sahara Africa, the food import bill a year is about 35 billion USD. So, and right now we do have logistic challenges, and it put therefore a pressure on the food system. We know very well that globally speaking, internationally, you don't have a food shortage. But given those logistic problems, we have a challenge for the food to arrive in the ports and therefore in the countries such as Ghana or elsewhere, let alone from the capital like Accra into the hinterland to those small communities there, which is one of the major challenges. So the risk of having an upward pressure on the price is still high, although globally we don't have a shortage on food on the production side. But more than the import side, the existing production itself is at danger because of the inaccessibility of the fertilizers or any kind of input by the farmers. On a non-agricultural or non-food sector, when you look at peoples that are either below the poverty line, a lot of time they have to count on the remittances from abroad. And because of the lockdown in Europe, in the Americas, and elsewhere, it has a direct impact on the amount of the remittances that are now being sent back to the family's home. And therefore, it also has a direct hit on the livelihood of the family. This is why we are really calling that every one of us should really be working with the government. So that being said, what is also quite very fantastic, I must say, is that both at the African Union level, both at the regional economic communities like SADC in South Africa, ECOWAS in West Africa, East Africa Community, EAC, and so forth, they are quite very, very organized, which help dealing with the problem at the sub-regional basis. One of the challenge on the health side that we have on the continent right now is to how do you make sure that you secure enough tests as part of the prevention that you are referring to. Everybody knows that we need to do extensive tests. President Horta mentioned how they went about the testing. So, and having the test kit made available and bringing them, channel them, is also one of the challenges where the head of state organizing through the African Union and through some of the private sector in Africa to address those issues. So it is also, you can also see that contrary to the past shocks that we face, the continent is reacting with a much more positive, much more aggressive manner. That being said, we just don't know, as I said before, when we will start, the curve will start going downwards. Over.
All right, so we don't have recipe. Now, Ambassador Amorim, I was about to ask you about the trade situation, how we can manage the production and the way that we can deliver products. Brazil is a big producer of agriculture products, but we are now not able to export. How Brazil and how is the situation that we can face in the future without having the borders open? So the trade is being impacted now. What's your take about this?
Well, I think in the short run, of course, we'll have to cope with the situation as it is. I understand that some trade continues to take place. The kind of goods that we export, mainly to China, by the way, continue to be exported in terms of soybeans and things like that, sugar and so on, commodities. But what I think is important to look at for the future, it's more reliance on local production, and especially on small agricultural, small farmers who produce for the local or regional markets, as mentioned by our friend Dr. Houngbo. And I think this is part of a change that will have to take place in the world system as a whole. I mean, I don't want to go too far to abstract things, but I think we don't know yet the full effects of these pandemics. We don't know if it will continue, if it will, after a while, maybe affect more some other countries than they did so far, than it did so far, like in Africa, for instance. We don't know. We really don't know. And maybe the time that this vaccine and that can, then it will be able to avoid things. So that would in itself pose new problems. How access to medicines, how can we have vaccines without having to pay exorbitant prices? Not only for every country, including the poor.
All right. So I'm sorry again. We are having problem with the microphone of Ambassador Amorim. I'm pleased to say that we have audience from many parts of the world. I can say from Brazil, from Egypt, from Indonesia, from Italy, from Argentina, from Accra, Ghana. So it's good to have their participation. So you are back now, Ambassador Amorim. Please continue.
Yes. I have a problem with my internet here. Well, it's a very crowded place here in Copacabana, where I live, but I mean, which is bad for the coronavirus, but bad also for the internet. But anyway, well, I think it's necessary to have more and more reliance on local production, and especially for essential goods. And I think in general, let me say one thing that it's a little bit outside what we have discussed so far, but how will be the world be shaped in the future? Dr. Gilbert, of course, is the person responsible for a very important organization. Ramos-Horta is a man of global views. We have to think in a new forms of organizing our world. I'm not saying that capitalism will finish or globalization will finish, but we'll have to organize the world in a way in which profit, especially profit for the financial sectors, is not the main thing. So that we can, for instance, I mean, health was almost a kind of footnote in every other deliberation that we used to have in the United Nations. Even food security, only recently food security and health, because of the pandemics, started to become treated in a more appropriate way. And I can tell you, I participated in a panel called by Ban Ki-moon about Ebola, which of course afflicted most of all at that time some West African countries, I believe Guinea, Sierra Leone, and Liberia. And if you take the conclusions of that panel and you see the summary only of the conclusion, you'll see that what's happening now was foreseen. It was said if something is not done immediately in terms of prevention, in terms of alert systems, in terms of reinforcing health systems, the next pandemic will come, and they describe the effects very similar to the ones that we are feeling now. So I think I think we have a dilemma in the future, which is very important to face. On the one hand, there will be an isolationist tendency, which is not good because it will prevent. But on the other hand, we cannot just come back to globalization in a totally unbridled way. So I think we have to find a balance, and the balance will be mainly in terms of cooperation, international cooperation between countries, taking into account local needs. Again, just another example. I dealt with the question of patents for medicaments. Well, it was seen as an exception. The health was seen as a small exception for an agreement that was mostly directed toward total opening. I think it has to be the contrary. Health, food security have to come first, and then you see what else we can do for trade and for profit and so on.
All right. The provocation that I made on trade brought some important discussion and health and food security. And I know maybe we need to have another webinar to discuss about this. But I'd like to take the opportunity, referring what everybody here mentioned, which is cooperation. And I know South-South cooperation and triangular cooperation is in the agenda, or should be in the agenda. For Brazil Africa Institute, I'm very pleased to say that we are concentrated in discussing and bring good experiences from many places. You mentioned, Dr. Horta, about the Cubans, doctors from Cuba that came to parts of to help, to give some help. But let me address something important. And I have here two participation. Professor Paulo Speller, he mentioned about the importance of South-South cooperation, and also Klaus, one of the important employees of IFAD here in Brazil, he mentioned about the support that we have to give to poorest people, who are the ones who suffer much. So come to the question, what is the role of the South-South cooperation, Dr. Ramos-Horta, in your view, that could bring solutions and support for countries?
Well, we have, let me talk about the fragile states. There's a group of countries in conflict, transition to democracy, transition to consolidating peace. They formed a group called G7+, small G7+. These countries were making tremendous effort to reconcile, to consolidate peace in our respective countries, and then hit by this epidemic and a global recession. So we will have several 100 million people that will need emergency assistance to prevent starvation, malnutrition, breakdown of the health system, but also politics, to prevent the collapse of the entire efforts that these countries have undertaken. Then you have, beyond that, the LDCs, the least developed countries. And then you have other larger countries like India and others. Because look at the world, the figures. United States alone has close to now 40 million unemployed. U.S. deficit is stratospheric for a long time. Europe, without offense to my European friends, is a bit in disarray, leaderless. They have to deal with Brexit ongoing, divisions within Europe instead of a unified Europe. We have a lot of problems. And then you have some megalomaniacs in the international system that a few months ago launched an oil price war, Saudi Arabia and Russia. Saudi Arabia believed that it could challenge Russia with overproduction. And look what they did to oil price. So commodity prices affected every country in the world that depends on export of our commodities, including my own country. So how are we going to resolve this? Of course, we address the issue of COVID-19 from a medical, scientific way, as advised by our doctors, as advised by WHO. But in parallel, we have to save people. We cannot lock down. We cannot paralyze factories, agriculture, fisheries. But so how we are going to prevent that hundreds of millions of people are losing their jobs, their livelihoods? Look what India did when they locked down. People had to walk for days and weeks And what is going to be their reaction? Well, we were shocked to see the street violence by the yellow jackets in the streets of France. We have seen violence in Greece in the first economic crisis of 2008, 2009 till 2011 with austerity problems. We saw problems in Asia, particularly Southeast Asia, in the financial crisis 2007. 97. That was a long time ago. And well, I would say that is nothing yet. We haven't seen nothing yet. If the international community, those with power, with privileges, Europe, United States, and the rich of the world, do not get our act together, their act together to address these issues, we are going to have real instability across the world. It will be worse than we are watching today. So my advice to the Europeans, to the Americans, to the Japanese, to the Chinese, to the Russians, be mature, be adults, come together to develop a strategic plan for the recovery of the world. Review all the mistakes of the past, all their arrogance, their egos, and the war in Yemen, and the war in Syria. Look, there are 3 million refugees in Turkey at the gates of Europe. How long these people are going to be there? And so this is what we have. Coronavirus only expose the inequities in the world, expose only the failure of the leaders of the world in addressing the problem of Syria, Yemen, extreme poverty, and it's going to be worse if they don't get their act together.
All right. Thank you for your advice. And I know this critical moment, it's affecting many other issues. And I understand that what you mentioned, the advice that you brought here, could be very helpful if people take this under consideration. But let me now address a question. I'll come back to you, Dr. Horta. Don't go away, please. Dr. Gilbert Houngbo, you mentioned something very, very important. Earlier, you mentioned the social economic impact. And I refer what Ambassador Amorim mentioned of this, the needs that we need to face for food security. What's the role again? You are now seated in a very important place, leading an important organization. How can you bring countries together to help poor countries, especially in Africa? Please.
No, there are different different ways. IFAD, the International Forum for Agricultural Development, what we have been doing at the earliest stage, as I'm speaking, we received about 70 requests from 70 countries, which is countries that are normally we do have projects in. So our first immediate reaction, knowing that we are not a humanitarian agency, our colleagues from WFP are doing the humanitarian work, and UNICEF, HCR, and others. From a development angle, though, we know that we have to start now to minimize the risk of the small producers, the small scale farmers start selling their meager assets to survive. So what we start is to repurposing our ongoing project so we can use the resources of the project into the urgent activity that the government has decided. In Brazil, we are doing the same in the northeastern part of the country where our projects are. Which is, so one is repurposing the project. Secondly, we do have existing resources which we allocated to some countries, which where it meant to go for a specific activity, we have accepted to really redirect those resources again towards activities, for example, buying early supply of seeds, planting seeds, or early supply of fertilizers, so the government can increase their stock for the year. The other thing that is happening, as you know very well, IFAD being also a financial institution, we have a lot of requests for a deferment of the debt service, of the payment of the debt service for the coming month, several months, which we are working closely with our colleague in Washington, namely the World Bank, for coherence approach. And the decision made by the G20, which has been quite a landmark decision in really authorizing countries to low-income countries to defer their payment. Even in that, what is happening now is 2 or 3 days ago, to the best of my recollection, countries like Mali, like Nepal, have just signed with the Paris Club. But a lot of countries that normally go to the financial market for the financing of their own development, they are worried that by taking that offer, that can have an impact on their own credit rating, and therefore jeopardize their ability to continue financing their economy right now and in a post-COVID perspective. So that itself, so the decision by the G20, which is a very good decision, is still not implementable right away because of those conditions. The other part, and you talked rightfully about cooperation, is that the work to do that is so tremendous, is so huge, that we need to have a cooperation to make sure that we don't step on each other's toes, and to make sure you get the best effectiveness in what we're doing. And for that, I really want to use this opportunity and salute the initiative by the UN Secretary General and the colleague from the UN in New York. So right now, the regional coordinators in countries are very well organized to bring all the UN agencies together so they can coordinate their intervention through the need assessment and the discussion with the government. The other thing that is quite very, for me, very helpful is the role that the private sector, Dr. Amorim, Ambassador Amorim was touching on that, the role that the private sector can play in the current circumstances. And in addition to the traditional corporate social responsibility, where you have a lot of companies that are coming up trying to help wherever they can, even right now, we saw what is happening in different places of the world, where some of the private sector are reorganizing their production cycle to start producing masks and others. And that is also happening in Africa. However, it's still not sufficient. So the import of medical equipment and the testing also is still something that, under that cooperation, we shall be able to continue assisting some of the most needed. The other side of help that you see developing is how do you start, while you keep the momentum on managing the health crisis and the socio-economic impact that we have now. But will your day after COVID, if I can use that term, we very likely know that the day after COVID will not be the same as today. So how do you, as a government, how do you start planning for next year, next years to come in the day after COVID environment? How do you start adjusting your priorities? Very clear, you really need to revisit our priority and our business models. And that, again, is going to be a need for us to all the international community to work together on that. Over.
Okay, thank you very much, Dr. Gilbert Houngbo, for your ideas. Ambassador Amorim, I know that you are a fan of cooperation. During the time that you've been Minister of Foreign Affairs of Brazil, you tried to put together different countries to bring different solutions. And bringing the quote from Professor Calusto Juma, I know some Brazilian solutions was taken to Africa, and I know that. So what is your impression about the South-South cooperation, the cooperation that we have among countries from the South Hemisphere, but also how can we bring the attention from the North as well? So what is your take about cooperation?
Well, first of all, Brazil has always been a champion of South-South cooperation. Not so nowadays, unfortunately. But and in the case of the COVID, to be more specific, we would be more on the receiving side. We should have been, and you could have received some cooperation from China, especially, which was the first country to go out. I don't know if China had its problems, but certainly it was. Just a moment. No, okay. China had its problems, but in any case, it was able to go out of it, and we would be normally to receive. We didn't for different reasons. But let me say, I think South-South cooperation continues to be very important during the COVID and the day after. I think it's very important to speak about in the fields of health and in the fields of food, especially food production by small unities. A country like Brazil, in terms of agriculture, I used to say that in the WTO, in order to have a better understanding. Brazil is a mixture of United States and India. We have the big farms, as the United States has, but we also have the small agriculture, which is essential for the local markets. And I think we learn a lot about that, and I think that could be transmitted in a cooperative way, as we try to do all the time during the President Lula's government and in other governments, unfortunately not so nowadays. But let me also say a different thing. I think also the role of international organizations is crucial. I think one of the aspects, I think this is implicit in many of the things that Ramos-Horta said and also Gilbert Houngbo said, is the question of equity in the world. How we face, because in our countries individually, but around the world also, these pandemics hits people in different ways. It is true that rich countries are not being spared of these, but within the rich countries, poor people who had less possibility of having health plans or have access to hospital beds and so on, are being the most affected. And again, when it comes to the vaccines and to the treatment, because I think in the end we'll find a way, again that will come. And for all those things in which South-South cooperation is important, crucial, but it does not diminish the importance of the rich countries, of the countries with more resources. And I think it's what we have been seeing in relation to the World Health Organization is regrettable on the part of the leader of the leading country in the world. And I hope that the future will bring a better balance in that respect, because we cannot dispense with, in terms of budget, in terms of support, technical and scientific support, also what's done by the rich countries. South cooperation, of course, is very important, can complement, it can show that things can be done in a different way. It can teach and transmit experiences which other developing countries have, and I think that happened in the past, it can happen in the future. But again, a better balance in the world is necessary, and I think this is what is the big challenge we will have to face as the COVID will start to wither away, and as we go into a post-COVID era, which is maybe not completely post-COVID, but to some extent post-crisis era. And I just to mention, and I'll finish with that, we have in Latin America, because of the dissatisfaction with many of the governments, Not all of them, of course. Mexico and Argentina have governments that are very much geared to social progress. There is a group of leading politicians that was called the Group of Puebla. And in the Group of Puebla, there was a proposal, which was, I believe, already transmitted to the Secretary General of the UN, to have an extraordinary meeting of the General Assembly, which of course has to be a virtual digital meeting, online meeting, on a special meeting of the General Assembly to discuss all the aspects that have to do with the pandemics, with equity, which includes, of course, the idea of food security, includes health, but includes also even aspects that relate to peace. One of the most absurd things that we have seen, and the Secretary General has spoken about that, is to have countries that are under sanctions being prevented from receiving humanitarian help. This is not only against international law generally, as unilateral law, it's against law.
Yeah. Yeah, looks like we are having problem with Ambassador.
But no people who are interested in the world to speak about, and that's humanity, important.
All right. Thank you, Ambassador Amorim. Now,
okay.
Thank you. I'm very pleased to hear your ideas, but we only have a few minutes to conclude this important discussion. Let's pretend a child, with the simplicity of a child, comes to you and say, please, give me the answer. How can we live after the COVID? So you have 2 minutes to answer this question with a simplicity that we need to give to a child question. Ambassador Amorim, I start with you, please.
Well, I say one word: solidarity. Solidarity. Well, as people have said already, in this, either we will be going to be all saved or no one will be saved. That's between people and between countries.
Very good. I think solidarity is a very important word to be used in our daily vocabulary. Gilbert, please, you have just 2 minutes to answer this simple question to a child.
Actually, I will say to the child that, coronavirus might not be gone. We just need to learn to live with it by just changing our daily behavior. And there is a silver lining to everything. And in this case, I want to join Ambassador Amorim. The silver lining in this case is that it doesn't matter if you're from the north or from the south, if from the elite or from the populace or whatever you want, we are all in it together. Either we make it together or we shrink together. And I'm sure we will make it together.
Very good. I know you are good, the both of you. Now you come to Dr. Ramos-Horta. I know you have a simple answer. I'd like to mention that I have an important audience. I have Anita Amorim. She's now in Geneva. Thank you for your participation, Anita. Dr. Ramos-Horta, now it's with you. The word is in your hands, right? So how can you give a recipe to a child?
One hopeful sign is that malaria has been with us for at least 100 years. No vaccine has been found except for children. But right now, in only a few months, since COVID was identified, there are at least 100 vaccines and treatments being studied, and some can be found in the next few months or early next year. That's the good thing, because unlike malaria, which was an illness of the tropics, that kill only people in the tropics and maybe a few white missionaries in Africa and Brazil and in Asia. Well, coronavirus is affecting the rich people, the rich countries. So everybody's working towards that end. So we might have a vaccine, a treatment for that. That's the good news. And I hope that the good news also is that finally the leaders of the G7, G20, the big banks, big universities, big foundations, the richest of the world, like Bill Gates, follow the example of Bill Gates and the others, try to help those brothers and sisters of ours, cousins, who live in shanty towns, who live in favelas, better prospects of future. It means what? Real support, not the so-called foreign aid of the last 50 years that has brought very little to the developing world. There has to be a complete review of ODA. There has to be a re-strengthening of the multilateral system that has been undermined in the last 10 years, in particularly under this US administration. We need stronger WHO, stronger UNICEF, or stronger UN agencies. And we should not undermine these institutions that exist. There are weaknesses, we try to reform, we try to change, and not making the WHO, for instance, a scapegoat for the failures of US leadership. And we know that. I know how the UN system functions. I know that China does not dominate WHO. The US has actually greater influence throughout the UN system. So I hope that the US president change his this attitude that consistently undermine the international system, abandon treaties that negotiated by previous administration for 10 years, refuse to pay the dues of the United States. Well, if the United States doesn't do that, doesn't change, if Europe is unable to come together, well, then I see the pessimistic scenario.
Well, thank you for your final words. I think the child that will listen your advice will need to think about something that Ambassador Amorim mentioned, which is solidarity, right? And I think without solidarity, we cannot go very far. I'm so sorry. I'm very sorry to say that our time it's over, and I wish I could have more time, 2 hours more to have this conversation. But now I'd like to thank you, all of you. I'd like to thank you, Ambassador Amorim, for your participation, President Houngbo for your participation as well, President Ramos-Horta. It was very good to hear your voice again. I'd like to extend my appreciation for the whole participation of people in many parts of the world. This webinar will be available in our YouTube channel, so you can go there and listen and take all the advices that we received from these important guests. So once again, thank you very much. It was a very important moment that we created now, and I hope the information that we had here was valuable for the future to come. Thank you very much.
Thank you.
So much.